This video I will continue talking about extending longevity to infinity. I believe people can live forever young. And can we use hormone therapy to reduce arterial aging? Again, I will share my experience and also will go to the sources of information and how it can be used. So this video is a short introduction, and I can go to details in the next video which I have available this week. As always, I recommend you to download this presentation as PDF file, then you can go to the references, to the source of information, make your own research, which I really recommend you. Don't rely on my opinion. It's again what works for me maybe not work for you. So decide for yourself. Without clear understanding what is aging, it is impossible to get good results. So let's go. Aging is natural process. Yeah, well, it's natural, but it can be reversed. Okay, you see, it can be reversed or slowed down at least. Aging is a natural process that affects all organs and tissues, including the arteries. Arterial aging is characterized by a loss of elasticity, thickening of the arterial wall, and impaired blood flow. This can lead to hypertension, atherosclerosis, and increased risk of cardiovascular disease. Hormone therapy, including estrogen, testosterone, and DHEA, has emerged as a potential therapeutic approach to reverse arterial aging, and it's quite popular, I should say. This presentation will explore the mechanism by which these hormones can impact arterial function, and I will discuss the potential benefits and risks of their use in the context of cardiovascular health. Okay, let's start from estrogen. Estrogen is female sex hormone. It plays a crucial role in maintaining vascular health. It exerts its effects by modulating various cellular processes, including angiogenesis, it is growth of new blood vessels, wound healing, and immune responses. Estrogen's influence on arterial function is particularly notable in postmenopausal women, where declining estrogen level contribute to increasing arterial stiffness and hypertension, also to aging of skin, which is quite visible. Estrogen protective effects on the arteries include vasodilation, reduced inflammation, inhibition of smooth muscle cell proliferation, and enhanced nitric oxide production. Estrogen prevents degradation of elastin and collagen, modulates matrix metalloproteinases. This is enzymes which destroy elastin and also collagen. It improves angiogenesis, as I said, and wound healing, enhances immune responses, and helps maintain blood vessels and skin elasticity. Okay, the blood vessel elasticity and skin. Okay, that I live in Thailand, and you know Thailand is quite famous for the lady boys, trans people. Yeah, it is amazing how many beautiful, absolutely beautiful creatures, and these were biological men, but then by taking huge doses of estrogen, they change the appearance and become like looking very much like women. Of course, you can distinguish is it true, is it woman or not. For example, because of very absolutely huge doses of this pills, anti-baby pills, they use anti-baby pills, but in huge doses, more than it is recommended for women. And skin is so soft, so gentle. The appearance of them is fantastic, but of course they are men. Inside they are men. They are not women. They can look very similar, or actually much better than Thai women. Normal average Thai women is not as attractive as this lady boys. Lady boys are fantastic. Some of them, not all. Some of them absolutely fantastic. But what is you can distinguish them by voice and behavior. They are warriors inside. They are quite young, and they have such masculine properties, but I mean, inside the character is they're warriors, but yet the appearance can be very feminine, and skin is soft, and breast is big, and blah blah blah. So it's again, don't be confused. Don't be confused. They also use some surgical procedures to improve their appearance. So, but again, poor people. Unfortunately, these huge doses of estrogen shorten their life. They help to keep them very attractive and physically beautiful in younger age, but then maybe 40-50 years old, they don't live too long normally in average. So it is not a way to extend your lifespan. But again, the effect of estrogen can be fantastic, but again, I don't recommend it. It's again, people crazy because again, some men, because now it is so common that kids are confused because of so much estrogen and so much substances which dysregulate hormone balance in children. Some children feel that they are girls, and then to get this experience and to change their bodies, they use this estrogen pills, and they indeed it works for them for a while, but not too long. Yes. Okay, this is what is commonly used, and women who use this estrogen pills, some women start to use these pills in younger age, and the result is disaster. Maybe it is quality of the pills, I don't know, but in Thailand so many girls are getting infertile with this pill. So many. The fertility rate in Thailand is 1.1. Why? Because again, they use these pills and not to get pregnant, and this culture, this feminism is not much has not much influence among Thai women. They are not bad, I would say, but yet again, it is not good idea to use these pills. And if they use these pills and go into this carousel, and then they destroy their life, the consequences could be absolutely disastrous. Okay, so be careful. I am against hormone replacement therapy. I use it like I use these injections of the growth hormone. I will go to this a little bit later, but no help in my age, no help. Okay, hormone replacement therapy with estrogen has been widely studied for its impact on arterial health in postmenopausal women. Numerous studies have demonstrated the potential benefits of hormone replacement therapy in mitigating arterial aging and improving cardiovascular health. Yes, it's amazing that again this estrogen improves elasticity of skin and arteries. Yeah, it's amazing. And hormone replacement therapy have been shown to reduce arterial stiffness, to reduce blood pressure, and improve endothelial function in postmenopausal women. These findings suggest that hormone replacement therapy can effectively address the cardiovascular consequences of declining estrogen level, promoting a healthier cardiovascular profile. Okay, maybe it works. I don't recommend, but again, if it works, because again, some men have declining level of testosterone, and maybe for them testosterone can help, but again, the side effects for testosterone is huge, and it's not good. But for estrogen, for women, if they are already in postmenopausal time, then maybe some using of this hormone replacement therapy in many forms can be maybe promote better cardiovascular profile. So again, it is risky, and because what can be the increased risk of blood clots, especially if they follow standard diet, and stroke, of course, because of blood clots, that stroke and heart attack. And breast cancer very much related to estrogen. Therefore, the use of hormone replacement therapy should be carefully considered and discussed with a healthcare professional. It is risky. Again, people who use it, they take a lot of risk and don't live too long normally. About testosterone. Testosterone, this is a male sex hormone, also plays a crucial role in maintaining vascular health. Similar to estrogen, testosterone influences nitric oxide production, leading to vasodilation and improved vascular compliance. This vasodilatory effect helps to reduce arterial stiffness and promote healthy blood flow. Notably, both low and high level of testosterone are associated with increased cardiovascular risk, highlighting the importance of maintaining optimal testosterone level for optimal vascular health. Optimal testosterone level improves vascular health, but high testosterone increases the vascular health. And yeah, okay, so it's again, you have to understand what you're doing and do it in close cooperation with your medical professionals, with your physician. Testosterone replacement therapy, okay, has gained attention for its potential to address age-related declines in testosterone level. I have a video about this testosterone replacement therapy. I would tell you that my opinion that if you follow proper diet, you will not see a decline in testosterone production in men. It is naturally, men can keep testosterone level quite high. It depends on your diet, on health of your digestive system. So it is complicated questions. But if you can measure, okay, if you have low testosterone level, some people use it. Some people use it with some interesting result, but again, it is not making them younger. It makes them more masculine and maybe more active, but it's a risk, always the risk. Testosterone replacement therapy can improve endothelial function, promote vasodilation and low blood pressure in men with low testosterone level. Okay, if you have low testosterone level, maybe that again, many bodybuilders use it, but they live not long. Some people die, some bodybuilders die in age of 30 or maybe 40. So it is again not natural way to live. These effects contribute to reducing arterial stiffness and improving cardiovascular health. Some bodybuilders misuse anabolic steroids to increase testosterone below normal levels and boost muscle growth. Yes, it's very popular among bodybuilders. However, it is important to emphasize that testosterone replacement therapy can also carry a risk, including cardiovascular events, and should be considered carefully under supervision of healthcare professional. I would never recommend it because again, there is a natural way to produce more testosterone. It's but okay, some people are crazy. They don't mind to die young, no problem for them. Testosterone boosters increase the natural production of this hormone within your body and may benefit men who are deficient in it. Okay, so it's very common. But again, so many side effects. If you want to get the hypertrophy of the muscles, okay, again, it depends what price you are ready to pay. Because if you not produce your testosterone naturally, yeah, it is a disaster. It can be a disaster. While hormone replacement therapy holds promise for reversing arterial aging and reducing cardiovascular disease risk, and then okay, hormone replacement therapy can improve heart health by improving blood flow and reducing arterial stiffness, and have protective effect on brain health by improving blood flow and reducing inflammation. Estrogen and testosterone can reduce blood pressure by promoting vasodilation. Yet it is essential to consider potential risk and limitation of this hormone replacement therapy. The use of hormone replacement therapy should be personalized based on individual pattern factors including age, health status, and specific cardiovascular risk factors. Careful monitoring and close follow-up with a healthcare professional are crucial to ensure a safe and effective management. Again, it is very promoted. You can find books that people promote testosterone replacement therapy, injections of growth hormone. Well, it's not my way. Not my way. I tried. I didn't see any improvement. Actually, I got what I got. I got accelerated aging of my cardiovascular system. Okay, but indifference. Okay, I give some maybe compromise. So DHEA, it is the drosterone. Okay, you can read yourself. Is natural occurring hormone that declines with age. It is declines, but it is again not naturally decline. It declines, but with age. But you have to understand why. So it is again you can keep it steady in principle. Okay, the production of this hormone. DHEA is a precursor to testosterone and estrogen. Okay, so it is again if you don't do it things right, DHEA level will drop, and then your testosterone and or estrogen for women will drop, sure. And supplementation have been investigated for its potential to reverse arterial aging to reduce cardiovascular disease risk in older individuals. I use it. I will tell my personal experience a little bit later. DHEA potential benefits include improving endothelial function, increasing nitric oxide production, promoting vasodilation, and maintaining vascular elasticity. It reduces arterial stiffness and reducing inflammation. However, high doses of DHEA can lead to side effects, especially in women. Strange, but for women it is more pronounced than for men. And because it leads to hormonal imbalance, acne, hair loss, and mood changes. Therefore, careful monitoring and personalized approach are crucial for safe and effective DHEA supplements. Okay, you see, DHEA in blood, it is a little bit more modified chemically, but we can write as DHEA. It is in fetal. It is relatively high, then it is getting to maximum in middle of 20s, pardon, and then it is dropping, okay. And it is recommended to use up to 100 milligram of DHEA as a supplement for men, but for women much less, because again the level is not so high. For women it is maybe 15-20 milligram maximum. Or otherwise they will have this side effects. But again, if you look how DHEA produced, so because again, what is happening? DHEA, if you use supplement, it is going to produce testosterone first of all, and then in adipose tissue it is converted to estradiol. And what is happening? You can lose your hair. Because if you have too much testosterone and it is converted to active form of testosterone, then you lose your hair. This is what, and not to mention that your sexual activity may suffer from this. Progesterone, I would not recommend. Some people use progesterone as supplement, but it is producing cortisol, and it is not good idea. Okay, but whatever, DHEA people can use, but again, what you need for in natural way, if you have enough of cholesterol from animal fat, then no problem with DHEA, no problem. I use this DHEA in my time, and there were some positive effects when I was following ketogenic diet with a lot of the green vegetables and some vegetable oils. So I was not getting enough of cholesterol that time, and there were positive effects. Yes, so you can watch my previous videos and check. Definitely it was useful for that time. But when I shifted to carnivore diet and started to use animal based fats with a lot of cholesterol, and avoided to use eat vegetables, then Then I also tried DHA, no improvement. So my body was producing already enough DHA. So it's again up to you. You can use DHA as supplement if you don't have enough cholesterol from your diet, and especially if you eat vegetables, green vegetables, especially green vegetables, then you certainly deficient in cholesterol. And or if you use some medications like to reduce consumption of cholesterol, it is again widely prescribed statins medications to reduce production of cholesterol in your body. And also if you use phytosterols, I mean food rich in phytosterols are substances which block digestion of cholesterol from animal fat. And this substance, if you as a medical professional recommend to increase amount of green vegetables, then consumption of cholesterol is blocked. So you're not getting cholesterol from food. Plus, if you use statins and you block production of cholesterol in your body, then consequences is disaster, complete disaster. Again, I cannot give you now reference to publications, but just think logically. You need cholesterol to keep membranes of red blood cells fluid and soft, I mean elastic. Cholesterol is stabilizing membranes of cellular membranes and membranes of special red blood cells. And if your red blood cells are getting stiff, first they will die out, they will not work for long, but also they cannot go through small capillaries. So you will get chronic hypoxia. So, and then chronic hypoxia leads to cascade of degradation of your body, and I don't know, but again, it is widely recommended. I would not never do it. Again, if I understand that we need cholesterol from animal-based fat, I would avoid, and that's what I do, I avoid any vegetable oils. Sometimes I use coconut oil, not in big amounts, because it is saturated fat and it has some phytosterol, but much less than other vegetable oils, much less than olive oil, for example. Olive oil is much recommended, or from avocado oil. Yeah, it is so much that you have to eat avocado or drink this super healthy olive oil. It is not healthy at all. It is my opinion, but some professionals like Paul Masson, for example, I rely on his opinion also that it is deadly for you to use them. Okay, up to you. You follow. Also, what Paul Masson recommends, he recommends to avoid dairy products, including butter, and I completely, I with all due respect to his opinion, I don't do it. I rely on butter as a source of cholesterol and as a source of the fatty acids, middle chain fatty acids, which are absolutely healthy. Okay, and all my diet is based on dairy products normally. Okay, so this introduction is over. Please, if you want to support my channel, the minimum what you can do it is to like this video and subscribe to my channel, share this information with your friends and relatives. I work mostly for my own benefits. Again, I don't make any money from this, but if you want to support my research more, contact me with the Telegram channel, and we can discuss. Because in my videos I normally don't disclose recommendations, or that's not. I don't give any recommendation, but I don't disclose my protocols. I don't disclose what I'm doing, my results, because it's again, what works for me may not work for you. It needs very careful considering what you are doing. But some people, I am in contact with some people till now, and they follow my recommendations, and they got impressive improvement in health. So they're very grateful. to me. But again, maybe for them work, for you maybe not work. Okay, whatever you decide, it's your body, your choice. Okay, have a wonderful day. Ciao, ciao.